With pain assessment, I have just added pain into one of my vital signs because I think it's super important to make sure that your patient isn't getting in more pain or their pain is lessening since surgery or since they've come into the hospital for something like an MI. That's especially important to monitor for. Some different types of pain assessments that you can do. You can do the PQRST method or you can do the Colder method. Personally, I think the Colder method is a little bit more in-depth and you get a better assessment of your patient and how they're doing and how they've kind of changed since the last time you assessed their pain. Some things with PQRST, so you want to check what provokes it, what makes it worse. You want to check the quality of the pain. Don't ask your patient, hey, what's the quality of your pain, or you're going to get a sarcastic answer like, oh, it hurts really bad. You're going to want to ask him something like, describe how your pain feels for that question. Ask if it radiates. Does it stay in the specific spot where it hurts, or does it radiate to their shoulder or to their jaw? That's especially important with MIs. You want to make sure that they're not experiencing another MI. You want to have them rate the pain. You want to see, get kind of a baseline of their pain so that as you give them pain medication or other things like some distractions or any other thing to reduce their pain, you want to see if it's getting worse or better. It's not necessarily bad if your patient's pain is getting worse, because then you're catching, it's the fact that you're assessing their pain. If it gets worse, then you might suspect hemorrhage or something like that. Then you caught what the problem is, and then you need to take them back into surgery. Time just means when did it start. This is important with patients with MIs. They need to kind of rule out whether or not they can give certain medications by when the onset was. So the Colder kind of goes over a lot of the same things, just a little bit more in depth. The character, the onset, where is it actually located? That's important for you to know where your patient's pain is, because say they just had surgery in their leg and they've got this pain in their heart. If you don't ask them where it is, then you're not going to know. Something important might have happened that you need to catch before your patient passes out or something worse. The duration, how long has it been going on for? It might have started and kind of like gone away, started, gone away type thing. Or exacerbation, what makes it worse? What makes it better? So what relieves the pain? If your patient has pain in their arm that hurts when they have it in some weird way, then just move it back to normal, you know. Then you don't have to give them pain medications. Or if a patient doesn't really need pain medications, but they just need a couple of distractions to kind of distract them from the pain, then things like that will help them relieve the pain without having to get a doctor's orders for things. Radiation, seeing if it radiates to any other place. Same thing as we talked about before. So when you've got a patient with chronic pain, it's important that you assess it a little bit differently than somebody with acute pain. With acute pain, the onset is a lot more important. With chronic pain, what's more important is when did it start changing? When did the pain become a little bit different? These patients lots of times will have like a diary of their pain. Like whether it gets worse in the morning or whether it gets worse at night, whether it gets worse after they eat type thing. Lots of cancer patients or patients with chronic heart problems, chronic angina can tell you a lot about their pain. It's important to assess what the pain was like before it changed and then what it was like after it changed, to kind of get a baseline of what's happening with your patient. Ask them. Well, first off, you need to make sure that the patient, that the pain has changed. Just see kind of like what's going on with your patient, and just a little bit different than assessing for somebody with just acute pain, like from a surgery.